Hey there, are you dealing with a sciatica problem right now? Are you trying to do stretches and exercises that you either found on the internet or were recommended by somebody, whether professional or not? Well, just in case you are, and especially if you're not getting any better, it's not going completely away, let me show you the top 5 stretches and exercises that we recommend our patients not do because it's only going to make their problem worse. Now let me tell you who I am. My name is Dr. David Midoff. I'm an expert physical therapist and the owner of Paso Manual Physical Therapy. We've been helping out people with sciatica problems for years and years, and we always have to stop people from doing these things that I'm about to show you because it keeps them from getting better as fast as they can. It slows down our progress if they're doing this in addition to our treatment plans. So let me show you. Number 1, Cobra Stretches. So let me show you what that looks like. People usually lie on their stomach, put their hands like so, and then they press up. Sometimes they repeat where they go up and down. Sometimes they hold like this and stretch. If they repeat, they're almost doing push-ups like this, or for less aggressive versions, they'll go like this. This is one of the worst things you could do for sciatica, and I'll explain why really quickly. If you've got a sciatica problem, chances are there's some involvement of the very root of the nerve, which comes off the low back. When your back bends backwards like that, the opening in the spine, on the sides of the spine where the nerves come out to pass into the sciatic nerve, when you go backwards like that, it actually closes the hole. It's called the foramen. Closes the hole and it pinches the nerve and makes it worse in the long run. So if you're doing Cobra Stretches or any other version that looks like that, please stop doing that right away. Number 2, leg lifts. Let me show you what that looks like. Lie on their back usually, and then you just pick up one leg like so. You might do the other side as well. This is bad to do because the muscles that you're using when you pick up your leg like that are typically the hip flexor muscles. There's several muscles that are called hip flexor muscles, and some of those attach directly to the low back bones, the spine. And when they fire, they compress the low back joints, which in turn compresses the nerves that come out the sides of the low back that are the root nerves for the sciatic nerve. So you want to avoid any sort of compression to your low back. So doing exercises that use your hip flexors like that leg lift is not a good idea. The third worst thing you could be doing for your sciatic nerve problem is figure 4 stretches. These are done all the time, and let me show you. They're called different things, so in case it's not called exactly what I'm talking about, just look at the movements of all these exercises and stretches that I'm doing. And if you're doing something like this, don't do it. So this is the figure 4 stretch, or the glute stretch, or piriformis stretch is another name. You cross your leg over like so, and then you're gonna grab the back of this thigh and you pull up, and you get a stretch sensation all through right here. That area right back here is where the sciatic nerve lives. And so by stretching out the muscles in that area, you're also stretching out the nerves. Nerves do not like stretching. Muscles do if they're tight. If you've got a sciatic issue in combination with a muscle problem, you've got to make sure that you treat each differently, and that one treatment doesn't aggravate another body part. So if you're stretching the muscles out to get more muscle flexibility, but as a side effect stretching the nerve, which aggravates the nerve, you got to be careful with that. I would avoid doing this exercise. I would only do it in certain circumstances, and it needs to be guided by a professional. So avoid using this exercise, and if it's making you worse, stop right away. The 4th worst thing to do if you've got a sciatic nerve problem is stretching to touch your toes. Let me show you what this looks like. This looks different depending on who's teaching you, but you might be doing it in sitting with your legs like this, and then you're reaching towards your toes. Sometimes people do it with their legs open, they're reaching their toes like that. Or in standing, they'll lean over to touch their toes. Any way you slice it, you're bending your body in half, reaching towards your toes. Doing that type of motion is adding intense stretching to your entire nervous system. All the nerves in your body are getting stretched. It's almost always way too aggressive for the sciatic nerve. If you've got an active sciatic nerve problem, this type of stretching typically keeps the sciatic nerve problem there longer than it needs to be. Now, this stretch can feel good because it's stretching a bunch of other muscles, it's moving some joints that probably need to move, but this stretch is very aggressive, and I would wait to do anything like that until you've spoken to a professional about how to properly proceed into this stretch. Number 5, hamstring stretching. Everybody that's got a sciatic nerve problem typically has a very tight hamstring. The hamstring is the back of the thigh. On the back of the thigh, you've got a bunch of muscles back there, the hamstring muscles, and right between all those muscles is where the sciatic nerve goes down. If you feel tightness back there, it may make sense to stretch it out. But like I said earlier, if you're stretching out a muscle that also has an irritated nerve near it, you're going to aggravate the nerve and keep the problem there longer than it should. So let me just show you some of the ways that you might be doing a hamstring stretch that you were told or that you found, and you need to stop right away if you're doing this. One of the common ones is lying on your back, holding your leg like so, and then stretching your foot upwards like that to create a stretch sensation. This is going to stretch your sciatic nerve intensely, and it's not a good situation. It's not a good exercise to do if you're barely starting out with a sciatic nerve treatment. Another version is by putting your foot up on something and leaning into it like so. That will put a stretch to this area, but like I said, it's going to aggravate an irritated nerve. If you've got a sciatic nerve problem, it's an irritated nerve problem in addition to other stuff, muscles, joints. You might have an arthritis problem in addition to it. There could be a posture or a movement issue that isn't visible on an X-ray or MRI. Those all have to be considered and properly built into a plan to get you to solve your sciatica problem for the long term without surgery, injections, or medications. So I encourage you to find the right help and guidance when looking to find stretches and exercises for your sciatica problem. Please explore our website to learn more about sciatica and other ways that we help people stay healthy, active, and mobile while avoiding unnecessary surgeries, injections, and painkillers. If you're interested in hiring us to help you with your sciatica problem, you can call us at 915-503-1314. I wish you the best of luck with your sciatica problem, and I hope you get better really fast. Have a wonderful day.